Let me share my screen.
That sounds great. Thanks, Eugen. Hi, everyone. We're excited to be joining you this morning. And we are going to be talking about some work that Shift Health Accelerator and Build Healthy Places Network are doing in collaboration with one another to advance some policy interventions specifically aiming toward addressing the social determinants of health and ultimately trying to achieve racial equity. So we're going to start with Renae, who's going to give some background on community development and health and a little bit of background on the Build Healthy Places Network. And then Felipe and I are going to give some background on Shift Health Accelerator and specifically some of our work around centering community leadership to achieve equity. And then Bobby will summarize some work that we're doing in partnership together around a policy scan. And then we'll open it up to see where there might be some interest in addressing any questions and other areas to discuss that meet your interests. So with that, I will turn it over to Renae.
Thanks so much, Jen. And thank you, Eugen, for inviting us. Really excited to be here with you all today. Yeah, thank you for that, for advancing the slides. So I'm from Build Healthy Places Network. Our mission is to shift the way that organizations work across health, community development, and the finance sectors to collectively advance equity, reduce poverty, and improve health in neighborhoods across the US. We are the national center at the intersections of community development and health, and it is our aim to accelerate investments and scale solutions for building healthy, equitable, and prosperous communities. My background is in public health, and I have the privilege to get to work with all of these fine folks, Jen, Felipe, and Bobby, and others to do this. So I think that's another awesome part about the work. Next slide, please. I forget I'm putting a timer on so I can make sure I don't talk over time. Okay, so healthcare spends a lot of money on treating conditions, right? And they're treating conditions on that are caused by systemic oppression, such as racism, and creating conditions of poverty. And so the root causes we know of poor health and poverty are the same. That is the lack of housing, access to good jobs, clean water, education, transportation, quality, affordable housing, safe streets and neighborhoods, and financial security are all a part of that system that supports healthy development. And the two big problems facing us are one, that at least $1 trillion of what's spent within healthcare are avoidable from chronic conditions occurring in low income communities that have been systematically segregated, right? I think that's a lot of the work that y'all are studying within your programs. So healthcare is at this point where they're recognizing there's a need to meet the social needs, and they need some support to do that. And that's where we're starting to collaborate with community development. Next slide, please. So this is a little bit of how the medical system is shifting and changing. This is the way that they're changing in the ways that they're paying for services, going from a volume to value type of system. This is supported with the Affordable Care Act. So volume is the way that things have traditionally been done, a fee for service type of way where it incentivizes multiple services. This is also really fragmented and it lacks any type of population focus and focuses specifically on the individual. Moving towards a more value-based system, a value-based payment models that support coordinated care, integrated care with a population focus and strong community partnerships. So as we're seeing the payment model shift from volume to value, we're increasingly seeing that healthcare systems and payers are looking for ways to improve those social determinants of health and advance equity in the communities that they serve. So again, the community development sector is already investing in the social determinants in those same communities. I'll go a little bit further into that. Next slide, please. So in determining your health, people get sick because of where they live, their access to schools, to jobs, to playgrounds, the food system and environment, as well as what types of housing are there and affordable to families and people, right? And this creates the conditions in which people can thrive and be healthy and live, or not. So as we're seeing, next slide, that the body of research is piling up to show that zip code is more important than genetic code. So more than anything else, where you live, particularly where you were born and where you grew up, predicts your long-term health outcomes. Next slide. And we can see this in public health and healthcare in the outcomes of people. So one of the main outcomes within public health is life expectancy. Here we have a map of Chicago, which is where I went to public health school. Felipe is in Chicago too. And this we can see clearly the health inequities. And the health inequities are those differences in health outcomes that are predicted by one's social factors, one's race, income, class, gender identity, and other social factors. And they're inequitable because they're preventable and avoidable, very much like those chronic conditions, right? So in this map, you can see here on the green line, in the Garfield neighborhood, East Garfield Park, the life expectancy is 72 years. And then if you move a little bit further towards the Gold Coast, which is a more wealthier white neighborhood, you can see the life expectancy of 85 years. And that's a huge difference, right? That's like the difference of knowing your grandchildren or not. These are some really big issues that our neighborhoods are facing. And this pattern can be seen across most US cities. Again, health inequities, if we were to look at this by race, you would see communities are concentrated, communities of color are concentrated, and that's again by design. And there's a system that like bakes in a type of systemic racism from the way that cities are planned and designed. And then we can see them kind of like coming out into the health system within the health outcomes. So I know that y'all are aware of the history of redlining, historical disinvestment, and then discriminatory predatory lending practices, right? All of those practices that happen in the financial system have further implications for one's health outcomes, which is why we constantly are seeing that where one lives, the environment, the conditions of one's community affects their health. And just to say, like, as from like a data standpoint, like racism is a risk factor, not one's race. And so I think it's important that we're constantly looking at the history of why things are here in order to like go forward. Next slide, please. So the community development sector, as we like to say, is in the zip code improvement business. And this sector was birthed out of the Community Reinvestment Act in the late 1970s. That was an anti-redlining legislation, anti-redlining policy in their sector in a way, and now a very mature sector to invest into revitalizing neighborhoods. So their goal is to support investments into low-income communities of color, historically marginalized, to support better health outcomes, work outcomes across the life course. Next slide, please. And so the work of community development really looks like the social determinants of health, right? Those things that we know that cause people to be healthy and well, or to face barriers within all of these different places. And just to add that community development also works over the life course. So, so from inside your mother's womb into your baby, into your adolescence, into your older adulthood, that all of the work of community development, although they would not necessarily consider themselves health experts if you ask some of the community development OGs. Next slide, please. And so what we know are that when we look at the data, community development as a sector and health are really working side by side and looking at the same communities and with the same people. And as you can see here, this is a map of economic hardship and child obesity for Los Angeles County. And you see that the maps look pretty much identical. And we know that because if we have that type of like historical analysis, we know that there's some reasons for why this is happening. So it is our role and our job at the network to support intersections, to support partnerships, to support people working here to come together and advance some solutions. Next slide, please. So I have a couple examples of what this looks like, because sometimes it's kind of like, it's good to have examples and to get out of like theory and into the concrete. And so here's an example from Nationwide Children's Hospital in Columbus, Ohio. This beautiful building here is the Residences at Career Gateway, which they used a community development finance initiative called LIHTC, Low Income Housing Tax Credit, and partnered with a community development agency, which was Community Development for All People, to build 58 new affordable housing units and an on-site job training center that positioned, that supported people to get positions at the local hospital. So this was a large initiative that involved several employers and organizations and spearheaded by Nationwide Children's Hospital with their local CDC, a local faith-based community, as well as their Healthy Homes initiative. And as another example, this is a ProMedica and LISC partnership that was launched at $45 million. ProMedica was an integrated healthcare system in Ohio, and LISC is a community development financial institution where LISC, I think, or ProMedica put in $10 million, LISC put in $15 million. And this concept of leverage, right, which community development does very well. They were able to raise $20 million together to create this national model to improve quality of life and revitalize communities. And this effort was to scale up economic opportunities for access to good jobs and improve health outcomes in Toledo, Ohio. And what it did is it really concentrated on the capital, on the money needed in order to make these improvements, and supporting the on-the-ground technical assistance that was also needed to address those social determinants of health, which included housing, jobs, the built environment, all of those conditions in order to improve one's or the neighborhood's quality of life. And so with that, I think I'm passing it to someone on the shift team, and I'm excited to get into some conversations with you all. Thank you.
Thank you, Renae. I think Felipe, you're on next.
Yeah, it's me. I want to see all your faces, even though I see photos, which, you know, we can talk about that after. So hi, my name is Felipe Tendick-Matesanz. I'm with the Shift Health Accelerator, part of the leadership team with Jen and Bobby and several others. And so just a quick synopsis of who we are. We're really trying to simplify access to funds, to money, and really drive community-driven approaches and leadership and I would say kind of power. You know, we'll speak to that later. I can't get into a long debate today about that because that's a whole topic on its own. But just to say that there's been a typical way of doing things in this country. And so what we're trying to do is learn from leadership across the country that have been doing organizing across communities and addressing inequities and really understand what's been learned. And so a major leverage point that's been identified by our team and others who do this work is that one major nexus of power is finances, resources, especially financial resources. So how do we make that much more how do we make that much more owned by community community members? And so we're really experimenting, I would say, with that. We're taking kind of the knowledge from experts and those that have been working in these fields for decades, and then trying to apply it and create the right types of partnerships and squeeze ourselves into conversations that communities don't necessarily get into to really navigate and shift how, hence our name, how funding of this type of work happens. And so go to next slide, please. So I'll just give a little quick how we do that and maybe a little origin story. So about 40 plus of us got together. We're selected by the Robert Wood Johnson Foundation as health equity leaders across the country, or those that had very promising futures in that space and were doing very interesting work. So that's the photo to the left. That's our crew of 40 folks. And we got our brains together and we're like, you're not really going to make any kind of systems level work shift at all unless you're talking big money. Everybody gets $1 million here, 20 million there, but how do you really like move an actual sector or make a large kind of systematic change? We're playing kind of a small game here. So we started with the concept of maybe 100 million or 500 million, and what would it take to even get that kind of funds, and then focus those funds. And that's really like that was a conversation that birthed Shift. Bobby and Jen and Matt, our co-founders, kind of took that and started developing our concept. And so one major leverage point that, again, I kind of mentioned earlier is that a lot of the way the work has been done, especially within health systems, and when we look at health as a human right, or we want to fund health inequities, or we want to address health inequities, is that typically experts come to the table. Those experts aren't always folks that maybe they're very well educated, maybe they have some experience within institutions, but the challenge at place, as Renae was starting to touch on, is that social determinants of health, to really outline that to make these kind of changes and impacts upon the health of our populations, most that need, it really requires a systematic change. And so institutions sit within the nexus of power, and oftentimes, unfortunately, they're the perpetuators of inequities. And so we wanted to offer at least kind of flipping the approach kind of inside on itself. So instead of having experts, we said, well, communities are the experts because they're the ones that experience inequities more than everybody else. So those that reside within these communities that are most in need actually are best positioned and oftentimes organized and have been challenging the way that work has been done for I would say centuries. I know we're not that old of a country, but we can trace it back to the origins of the country. So we look to really use our models is working with leadership and leaders like the ones in our cohorts to then connect to their communities and the ones that they are invested in and have been invested in for decades, and to get into those positions of those conversations of how to shift these large kind of sums of dollars. Now, where we've focused our attention is on the space of outcomes-based funding, which is a several $100 billion kind of sector that controls funds. And so we wanted to kind of look at how outcomes are defined and get community right in those conversations from the get-go, control them as much as possible, and direct them. So So I've shared a couple photos here. I won't get into them too much because we have a short period of time, and I think there's probably more questions, and that'll be really an interesting place to go. But I kind of handpicked some of these from our colleagues. The one on the top left is from Hawaii, a community that we're working with some of our fellow leaders on Good Food, on a Good Food Alliance, looking at issues like food sovereignty. So who owns land? How is it utilized? How is that looked at from a health perspective? And how can that be leveraged to bring in funds? The one on the right, two, top and bottom, those are folks that I'm going to bring in. We're not there yet, but those are folks that I've worked with very actively over the last decade. And these are both Chicago. This is Chicago. So, you know, Renae, we're picking up Chicago a lot here. But just to say, they've been working on issue-based campaigns. So things like the carceral state, why there's so many Black and brown bodies in the carceral state, in jails or incarcerated or constantly being penalized and over-policed, or right now we have things like ICE and people and children being put in cages, and that's nothing new. Actually, this country has a history of it. So how do we redress and address those? So those folks are coming to the table. We're starting to look at Chicago as an opportunity to kind of leverage outcomes-based funding. And then the bottom I'll also say is also, that's in Atlanta. That's one of our colleagues in Atlanta who's also doing food sovereignty work. And really, again, just people know how to do the work. They know how to address it. But major point that's been the challenge is leveraging the resources and building out the capacity of the work. And so that's what we do. I can't get into it too much, and I apologize. It's like short time. So I'm going to give a little taste of it. I hope we talk more about it. And I know Jen will kind of lead us more down like a framework, and so will Bobby. But just to say, I think the most important takeaway is that we're doing that by really putting the focus on who's the expert through lived experiences, and then positioning those groups and those leaders in places and in rooms where they can leverage large sums of dollars to be invested in their communities. And how, I'll just say how we do that. Next slide. So some of it's through technical advising, supporting, working alongside our colleagues. Other ways is also by identifying the actual specific outcomes that are of interest within certain topic areas. So this might be get more into the kind of policy space, is how do you actually communicate that and get that kind of adopted. So we've created something called rate cards, which actually have defined outcomes per sector. So food sovereignty is kind of an issue area. The built environment's another issue area. Economic mobility is another issue area. And we've had our colleagues inform on what those specific outcomes are, again, based on decade or plus of work that they already have done. So instead of going back in the community and re-surveying, because the community's been surveyed to heck, they already know what's at play. So we started at benchmark, and we created these rate cards to communicate to outcome-based funders on why they should invest in these types of outcomes. And it positions our community members and folks in a place where they don't have to do double work. So I don't know if any of you work in nonprofits or that space, but just there's a lot of tallying and data recording. There's a lot of work to prove that you're doing the right work, when in case you've been doing it again for decades and it's proving itself. But just the work of documenting what you do and making your case sometimes takes up 75% or more of the work. So you get to do 25%. So our hope is to like kind of wedge that down and eliminate that. So we started with our colleagues, and I'll just say that we're constantly working. While we're not perfect yet, what our goal is through time is to continuously get better at getting closer and closer and closer to those that are most affected by an issue, to lead and direct and kind of inform us. And so we've started with our network of culture of health leaders and their internal networks. And we hope to expand that through the years to come. So hopefully that gives a little synopsis of kind of what we're doing. And if not, maybe it confused you. You got some great questions that you can ask at the end. But I'll transition over here to you, Jen. And I think you can give a little bit more on kind of our logic and our framework of thinking. Thank you.
That's great. Thanks, Felipe. Yeah, thank you for that synopsis, both Renae and Felipe. And I'm going to try to bridge us into some of the work that we're doing in partnership between Build Healthy Places Network and Shift Health Accelerator. And part of the central question that brought us together is around public policy. And we see public policy as a real opportunity to make lasting and systemic change. And if we think about public policy as opportunities to reduce barriers, create opportunities, provide incentives that shift the way that our neighborhoods look, the conditions that surround us, as well as the choices that are afforded to us and the opportunities that are afforded to us. So we've had the distinct opportunity and privilege of working together on a policy scan and strategy menu over the last 5 or 6 months that was spearheaded by Build Healthy Places Network as an opportunity to look at spaces where healthcare can partner with the community development sector to advance racial equity and to address the social determinants of health. One of the hypotheses behind this project really is that healthcare is seeking opportunities to affect health, and health is happening well outside of the walls of healthcare, and that community development as a sector is doing the work of improving the conditions of neighborhoods and places around the country. And so we want community development to be the go-to partner for healthcare. And one of the levers of change that we saw as particularly powerful is looking at public policy. And so what we've been doing over the course of the last number of months is researching a very wide landscape of public policy opportunities at the federal, state, and local levels to really create the conditions that will allow people in places to be healthy and live to their full potential. And so we've been using a framework, Eugen, if you'll go to the next slide, that was developed quite recently, actually, by the CDC Foundation and the Wellbeing Trust. It's called the Thriving Together Springboard. There's a large report and a number of resources online, and this is sort of hot off the presses, so I would encourage folks to Google it. It's a great resource. We really like it because of the holistic approach to thinking about health and well-being. And so this was developed specifically as an opportunity to think into the future coming out of this particular moment in history. And so looking at the ways that COVID-19 has really reinforced the inequities that have already been present in our society, and really opened up a conversation around health equity, really opened up a conversation around Black Lives Matter, around social justice, around the conditions and opportunities that we have to live healthy lives. And so this Thriving Together Springboard is a framework to drive multi-sector and a holistic approaches to thriving people and places. And so there are categories that this framework lays out: thriving natural world, basic needs, housing, work and wealth, lifelong learning, reliable transportation, and belonging and civic muscle as the key components to which a holistic policy ecosystem or intervention ecosystem can really be developed in order to hit the big components of neighborhood investments for healthy lives. So we've been using that as our framework for categorizing and understanding the policy landscape, and then building from there an action framework so that healthcare leaders, community coalitions and community leaders, community development organizations in that particular sector, as well as local policymakers, can come together to understand needs at a local level, select from this policy menu what is particularly relevant for local jurisdictions, and then push together a policy agenda that we think based on the potential for public policy to make systemic change to really drive an agenda together. So with that, I think Bobby is going to give us a couple of examples of the categories that we've looked at for this project and some of the policy opportunities that we think are particularly interesting for this type of partnership to take shape.
Cool, thanks, Jen, and Eugen, thanks for bringing us all together. It's we don't often get a chance to learn all the different pieces that we're working on together. So this is fun to be with you, Renae, and Felipe, and Jen too. Actually, Eugen, can you pop back one slide for me real quick before we dive into the nitty gritty here? I don't know if Eugen warned you all, but this is about where we need you to start helping us. So I'm going to ask you some questions at the end about particularly what kinds of policies you see as really potentially rich in connecting healthcare, community development, and the environment. You know, my background is as an environmental conservation guy, and to hear all of our health friends use metaphors like upstream public health and pictures of rivers and to talk about policy ecosystems is really fun. You know, we've always known the environment and health are connected, and I think we're just rediscovering that, right? That we had one of the biggest jumps in life expectancy because we don't have cholera. We don't have cholera because we have public sanitation. And, you know, similarly, you're starting to hear metaphors and conversations on the health side about looking upstream because of the challenges that Renae was talking about is, you know, the nasty visible problems of communicable disease are not what's killing people anymore. It's the distributed challenges and risks around racism, how we live and where we live that's causing problems. And same on the environmental side. It used to be in the 1970s, you could point to that pipe and say, that's what's catching the Cuyahoga River on fire, and let's just clean it up with some technology. That's not the challenges we're facing. And so looking at how this ecosystem kind of comes together and understanding the interrelationships among federal, state, and local policy seemed really important to be thinking about. And just starting with a quick story, I don't know how well folks know the area around Medford, Oregon, but it's in Southern Oregon. I'm based up here in Portland, Oregon. We had a really nasty fire season this September, amongst other places. But Medford is a kind of a semi-rural place. Already was facing an affordable housing shortage of about 5,000 units. And the Alameda fire that went through destroyed about 2,300 units, displacing about 5,000 people. And most of those units were mobile homes that housed farm worker communities, healthcare workers, other immigrant communities. It was all along Bear Creek, which is a tributary to the Rogue River. And the way that fire went is invasive blackberry along the river acted like a wick. And so fire shot along the invasive blackberry, was moved up into the canopy and neighboring parks and mobile home parks and burned hotter and longer. And that's where we lost structures. So all of these things are interconnected. And as the area around Medford's talking about recovery, they're quickly talking about putting those mobile homes right back in the floodplain. They're not talking about looking at income support. They're not talking about a whole range of different things when we know that how zoning and land use works affects health, when we know that there's no way we're going to create intergenerational wealth unless we fix income disparities. And we know that there's no way to be healthy unless your home is safe and high quality. And so really thinking about how all these policies come together, whether it's in Chicago or in a rural place like Medford, is what we're trying to do with this policy springboard. And so just to give you a couple of examples, go on to the next slide. One of the key policy areas that we're hearing a lot from our community partners as well as experts is policy that basically increases civic engagement and community engagement and the ability to control the decisions for folks who've experienced inequity. And there's a lot of really cool stuff happening across the country relative to citywide master plans. So these are the long range plans that counties and cities use to determine things like zoning. Rancho Cucamonga in Southern California now has a health component to its citywide master plan. The Oakland's healthy development guidelines include looking at racial disparities as well as environmental impacts around any kind of zoning or development guideline. There's also requirements around community engagement and trying to push for broader engagement and investing in the capacity for communities to be able to participate in decisions. So for example, Orlando has a leadership program where communities and residents are able to be trained up on what does transportation policy look like? What does land use and zoning policy look like? What is economic development and how might we actually change those so that you have a rotation of community leaders coming in and ready and understanding all the different pieces. And then finally, one of the other pieces that's coming up often is just paying much deeper attention to our current tax and revenue policy. So in California, there was Proposition 13 way back in the day that capped property tax increases. Prop 15 is looking at closing a loophole that would allow additional property tax revenue to go into things like schools, equitable development, transportation. So there's some really fundamental shifts afoot in a lot of localities around revenue policy. Next slide. And then a recent study with the Federal Reserve kind of identified this difference between income and wealth. And if we were able to close the wealth gap, say by increased access to capital, like the Community Reinvestment Act is designed to do, that increase or decrease of the wealth gap, if we did that in one generation but didn't fundamentally fix the income disparities, we'd be right back where we are in one generation. So what the Federal Reserve Bank is saying is we need to fix the income gap. And so looking at all the ways that we might be able to do that is really critical, whether that's access to capital, whether it's workforce development and pathways, entrepreneurship and small business is a really key policy area to be looking at. Next slide. And then another example that we looked at, and the health world is increasingly putting, thriving natural world right up there with, housing and transportation as critical to advancing overall health. So our worlds are all coming together. 4 of the policy strategies that we started to identify was kind of universal access to water, reducing exposure to extreme heat and air pollution, 10-minute walk to a park, and investing in for multiple benefits. For each of these policy strategies, under each of the vital conditions, we also identify a whole series of different potential policies that states, localities, or the federal government have enacted across the country. So the intent with the policy scan is to be a really broad kind of treasure map to strategies that we think could be really rich in advancing racial and health equity. And what is important for Rancho Cucamonga is going to be different than what's important for New Haven, and that's cool. But we wanted to give a place that community activists, local governments, healthcare, community development could work together. So we're close. We've got a draft kind of coming together here. The aim is to get a final released here in the next couple of months. And would be really interested in hearing from you all as we move into discussion about where are some of the areas that you see as the most potentially rich in kind of digging at these links between community development, health, and the environment. So Eugene, next slide. And I think Jen and Eugene, with that, I think we're just going to kind of open it for questions and conversations. Jen, did you want to set up some of these questions at all?
Yeah, thanks, Bobby. I think we just wanted to take a pause since we have given you a lot to chew on, I think, and just curious what jumped out and what specifically resonated and go from there.
Yeah, please feel free to unmute yourself and jump in.
Well, I'd just like to say that I thought that was a great presentation. I learned so much, and it was really so good to hear all of the different work and all put together so articulately. And it really seems like you're covering the whole range of issues. You know, one of the things I was thinking earlier on, like, you know, it's an issue of, you know, kind of income issues, and then you get exactly to that. I'm wondering, and you said there's a draft that's coming out on the policy scan. Are you going to be putting together some kind of like a website to share it? Are you planning workshops? Like, what's your what are the modes by which you're going to kind of get this out to all of the different audiences you have in mind?
Renae, what do you think?
Thanks, Bobby. Yeah, well, we're definitely going to get it out there. We want to have as many people see it as possible. So I'm trying to think, there'll be several ways I think to get involved. We're coming together with the policy council and kind of some leaders to take particular action. But again, we want to get it like out more broadly. So we have a listserv. Build Healthy Places has a listserv that y'all can sign up for. I'm sure we'll have other pieces and blogs about it. I'll go ahead and put a link in so you can get connected that way. And Shift may also have some other ideas too.
I have a couple things to add to that. So we're partnering with Renae and Build Healthy Places to launch this probably later this year, early next year. So we will definitely be pushing it out through listservs and through partners. Two additional things. We included the Legacy Springboard specifically because that framework is actually being used much more widely than just this report and the website where it lives. So I think we heard recently that they will be using that framework for the Healthy People 2030 at a national level. So we think that there's some leverage opportunities by using frameworks that are going to get a lot of kind of play nationally. So that's another opportunity to, we hope, get it out through additional partners that might see some opportunities. And, you know, Asha, I think one of the things that I've heard in conversations with you over the course of the last number of months is around thinking through faculty members who are doing research across the university that touch particular topics of urban planning and urban environments. And so, you know, this could be an opportunity. I think we're seeking opportunities to actually use this action framework for work in the world. And so I would also encourage, as this gets pushed out and finalized, if there are opportunities to say, utilize this policy scan and action framework to spur conversations both across the university and then also potentially in partnership with local policymakers in New Haven, that, you know, we would love to see that and love to support that in some way as well. Because the purpose really is to make it an action framework. So hopefully there's some stuff in there that seems particularly relevant to the work that you all are doing.
And Jen, I would just add one thing to that, particularly since Yale is one of those places where folks are virtually learning from wherever their community happens to be and where they might be doing final projects. That if some of what we're talking about is resonating for your work in your place, whether that's Eugene in Houston or someone that's hanging out in North Dakota, let us know. Let us know. It'd be good to hear what's going on in your place and your community.
And one thing I just want to add to that is that, you know, there are so many different things happening at Yale online. And so I'm glad we could record this because we're definitely going to make sure to share it much further for those who couldn't make it live today. And in particular, we're also working on developing a new class, which will be really engaging with the history of development in New Haven and then looking at what's happening in the present context. So I'll definitely want to include this particular webinar as something that the students can view and then start thinking about like what's the future, because the idea is to say what's happened in the past and how can we now rethink and think about the future. So hopefully we will really definitely be drawing on you guys for that work as well.
I'm also curious, that was really helpful. Thank you, Asha. I'm also curious if there was anything that was really confusing, hard to understand, if that's also something that we want to make sure that we're communicating to people in a way that like makes sense and is meaningful. So curious if there was anything that was just like what did you mean by that, or you know, just anything confusing.
I've got kind of a maybe a broad question. So how has your work or your approach changed since post-COVID, if any at all?
I don't know if ours changed. I think we just got more specific. I mean, I think Bobby and Jen, you might be able to chime in on this. It is like where the opportunities lie as well. So we went with a healthcare strategy. You know, where is funding within healthcare? You know, healthcare systems. So as that's pretty rapidly, well, again, Jen, Bobby, if my over speaking, let me know. But I think it's a rapidly evolving situation. Policy's not the fastest thing too sometimes. So, but there's just multiple threads that are playing out, I think, policy wise on the healthcare funding that we've just been keeping an eye on to see where the leverage points can be. So that maybe just more of a focus is a change. Kind of like, you know, if you're fishing, you're trying to catch the fish. We're seeing which fish we can catch. You know, we're trying to cast our bait out. So we've got a very specific type of bait. I like metaphors. I can't help myself. So, so I think that's the healthcare space, is like, how is that space evolving? You know, what are the funding mechanisms they're thinking of? I'll just say one thing that is of concern, and that I've heard from organizers across the country and other spaces, is that we were moving kind of equity and health equity and the understanding of it and how to apply it was being, not just in the healthcare space, urban planning, and a couple other sectors that work on populations at a larger scale. It was kind of moving more towards equitable practices. And with the shock, you know, of the virus, it's kind of people, because the status quo is not changed yet, it's very still in place. So some of those processes of equitable kind of community engagement and getting community more involved were kind of pushed aside. I've heard that from several public health departments. And just, it's an area of concern, I think, because folks just kind of went to what they already knew. Just institutions take a long time to change. So just to say that when it comes to community engagement, there's been a lot of concern on how that's been happening since COVID.
Yeah, I would echo, Felipe, what you're describing in terms of the focus and some of the challenges of working in a COVID environment. You know, I think for us, and Eugen, you've been along this journey with us. I think what has been happening over the course of the last 8 months is that there is more attention to equity and social justice and inequities in health, who's deemed essential in this time. And I think part of what we're trying to pay attention to is how do we really harness
Lavinia and Suman.
For
we had more people earlier, but they all kind of logged in.
For accountability. So I think there's an opportunity for us to hold accountable those commitments that institutions, healthcare in particular, are putting out there around, you know, commitments to equity. and really asking, like, are you actually committed to that? And if you are committed to those statements, then there's an opportunity to center what are our priorities at a community level. And so I think we see that as a real opportunity to hold those statements to account right now.
And something that's shifting from Build Healthy Places Network's perspective, we work a lot with healthcare systems, and as no surprise, like they're all focused on COVID and are pretty strapped right now in terms of resources. And so how that's changed our work is we're starting to look at different healthcare partners. So we've had to focus on health systems and hospitals specifically, and now we're moving and shifting a little bit towards healthcare insurance providers who may be more flush with capital at this time. And so we're starting to look at different healthcare partners in the system.
And I would just issue an ask back out to all of your colleagues there at Yale, Eugen, that I think your point, Renae, on a lot of the healthcare providers, so hospitals, federally qualified health clinics, even state Medicaid programs are feeling strapped around budget. And so they're pulling back to what they know, which is essential healthcare service delivery. But we also know that that's not exactly what's going to advance health equity. And so the extent you all can continue to encourage and remind those healthcare providers that the social determinants of health really do matter. And in a time of budget shortfall, that's a time to double down on innovation and community-led work, not retreat back to what you knew 10 years ago. And we are seeing healthcare providers of all different stripes showing up for political advocacy more often. And so encouraging and educating those folks as they're showing up on everything from wildfire policy to tobacco tax revenue to property tax adjustments, I think are important.
We have a couple minutes left if anyone wants to ask one or two last questions.
Oh, Jonathan, if you were going to, I had to mute you by accident because somebody was speaking in the background. So I don't know if you were going to ask something earlier.
No, I'm just so sorry. I should have muted myself before this background noise. Sorry.
No worries. I just want to make sure if you did have something to ask, you got the chance.
Jonathan, given your work in New Haven over the summer, what would be, are there things that resonate or things that you feel like, and especially as we're thinking about engaging more with New Haven through the new class, are there connections you see between the presentation today and what you saw in the city, working with the city this summer?
Sure. I think Bobby was talking about, and I think some of the other speakers were talking about the idea that we have storms and flooding concerns, and one of the biggest things that we have to take a look at is what happens to communities after these storms. How does a city respond? And it's not just have these people stay there and go through storms in the future, but also how do we make sure that people are safe, or people are able to move out of these danger zones, these flood zones. And that's one of the things that the city of New Haven is struggling with, both because there's a limited amount of land that a jurisdiction that the city has control over, and also just a limited amount of funds that we can dedicate towards these kinds of deeper health issues. And it's hard. It's hard to try to find that kind of funding and best way forward, but some interesting connections between health and the environment that we see in this panel. So thanks for sharing,
I would just challenge you to challenge your department, the folks you're working with. That I would argue that there's actually always budget, When you get in the nitty gritty, you know, I've done some municipal stuff before, and I'll say that it's amazing how there's never money for certain things and always other things. I'm not going to get into specifics, but like, well, no, I will a little bit. So like, I mean, the thing of teaching comes up a lot, right? Education resources. City of Chicago, for example, like 60+% of the budget is spent on policing, and the education budget's 20%. So the argument every year is that we don't have enough funds for it, but really it's a value. It's a question of you know, governance and values. More so than if there's actual budget. In my experience, I find that actually the budgets are usually there. It's just the creativity sometimes and the camaraderie that's necessary to like cross. So there's so many silos in department. You know, that's why I say institutions are long to change, but the leverage points are, you know, sometimes that those creativity, using a creative mind, getting those that are really close to situations involved, and engaged, but also just really pushing back on that. I refuse personally, and through my experience doing organizing work for the last decade, it's usually never really budgets. There's always money for, you know, certain things always seem to get funded in municipal budgets. So I would, you know, I would challenge you to, you know, challenge your colleagues on those lines, and really get them to really explain why, you know, why that is, and to explore the budget as a whole versus like departmental or narrowly. That opens the dialogue for, you know, uncomfortable conversations, but they're ones that needed to be had, because some of the challenges we have are, like I said, they're multi-generational. and this, the last thing I'll leave with, is also part of what we're trying to do on our team too, and a lot of us that work in the health equity space, is to expand the definition of health. Like, and for me, health is everything. Like, you can't breathe there, you can't have connection to humans. You know, there's lots of layers to it, but at the end of the day, living is health. The lot not living, you know, is the absence of health probably. So a lot of us are trying to cross these kind of cross the language divide and really get folks to understand that health really is everything. And if that's the case, you know, how do we align things based on values of living like a quality level of life, and how does that apply to a population? So I'll just leave with that. Just, it is an uphill challenge. I'll die before that ever gets, you know, too far, but I'll push as far as I can. And I encourage you all to start thinking about what you do in a health framework, and to continuously push yourself. So